Well, welcome to Nashville. I'm going to be probably the oldest guy you hear from here over the next 2 days, but it's a real honor for me to welcome you to Nashville. Again, we'll get the welcomes out of the way quickly and then jump right into 2 days of unbelievable content. And again, I say that, I do have the opportunity to speak around the country and to speak at a lot of technology conferences, health service companies. I run a venture capital firm and private equity firm, so looking at all the latest things. But to be able to welcome you here to Nashville, Tennessee is a great honor for me. I was born here 6 decades, a little bit over 6 decades ago, so I know the city, I know the building, I know the region, I know the energy, I know the companies here, and again, it's an unbelievable place. Nashville's a hot, hot place now, as you all know. So there are 3 things I'd like to do in the next few minutes, and then we're going to have a fireside chat for about 15 or 20 minutes with a great friend of mine, Dr. Michael Painter. Number 1, let me welcome you. Number 2, let me talk a little bit more about healthcare and innovation in the health service world. So we're talking a lot of technology, and we're talking a lot of computers, algorithms, going very quickly into machine learning and deep thinking and artificial intelligence and the whole world, obviously centered around blockchain. But all that's within this $3 trillion industry of health sector. It is not just healthcare. A lot of it's going to be health itself. Healthcare is a lot of the delivery. Health comes in with all the behavior and the genetic codes and where we live. And Nashville tends to base itself in the $2.3 trillion of health services, not the 0.7 of pharma and device, unless it's part of the health service industry. So come back a little bit about that. And the number 3 I'm going to mention, and cheating a little bit because I'm thinking about the elections tomorrow, nothing political and nothing about the elections, but why healthcare is different than a lot of fields. In a large part, it's because of government, with the framework of government regulation that we had, that we didn't have 30 years ago, and why that's important. And obviously, the nuance in there is why elections are important, why we do need to engage, why we do need to pay attention to what goes on in our local government, in our state government, and in our national government. And the best thing we can do is vote coming in. So number 1, my welcome to you. How many of you are from Tennessee? How many of you are not from Tennessee? Okay, good. So those of you who are not from Tennessee, sort of the why Nashville, Haley's talked about the initial part of the innovation, but now the more important things. Tonight at about 10 o'clock is when your real business starts. It's when you start network. It's when you really start talking to everybody. And the number 1 thing that you'll be paying attention to, besides the person across from you, is the whiskey that's sitting at the table. Nashville, Middle Tennessee, is the home to the most popular whiskey, not just in the South, not just in the United States, but in the world. That brand is Jack Daniels, and there's about a 50-50 or maybe a 90% chance you're going to have Jack Daniels with you later tonight. Again, a product of Middle Tennessee. Those of you from Tennessee, many people even from Tennessee don't know this, the fastest computer, not just in the South and not just in the United States of America, but in the world, is also a part of Middle Tennessee. In Oak Ridge National Labs, there is the largest computer. It's always, the surveys come out every 2 years. It's either here or it's in China. And right now, the fastest computer in the world is right here in a little bit of middle to east Tennessee. The old moniker of Nashville was Athens of the South. You'll see the Parthenon, a beautiful park, urban park, not too far from here. The Athens of the South moniker of the 1920s and 30s was because in the South, the first public school system was here, and there are now 17 universities and schools that are here. Again, that's important because a lot of the basic foundation of the technology, the IT development is associated to Vanderbilt, to Meharry, to Fisk, to Lipscomb, to Belmont, the colleges that are here. And the third moniker for Nashville is Music City, USA. And the Music City, USA comes from all sorts of things. If you have time to sneak off, go to Studio A or Studio B. Elvis Presley recorded more songs there than any studio in America, in addition to the country music that is here. And then the Silicon Valley of Health Services, and Haley introduced you to that. So welcome to Nashville, Tennessee. There are other things like Hattie B Chicken, which you don't want to be talking about, or Princess Hot Chicken. You don't want to talk about that at a health conference, but obviously you may slip by there. You may go down to Tootsie's right across the street or 2 streets over where everybody after the Grand Ole Opry would come and spend from about 11 at night till about 2 in the morning. Shift gears, innovation itself. I've already introduced it. $3 trillion in healthcare, $2.3 trillion in health service. The single greatest impact that you can have, that blockchain can have, is in making that $2.3 billion sector, huge investment opportunities that we just talked about, that we'll be talking about over the next 2 days, but to make healthcare more seamless, more personal. Get it away just from the big hospital systems where you used to have to drive and you go to a parking lot and then wait 2 hours in a doctor's office or in an emergency room to the doctor, but getting all that to the home in the distributed sort of way that blockchain feeds to. The issues of equity, the issues of reaching people, vulnerable populations that could not be reached in a private, protected way. All of the issues that you'll be exploring over the next two days are part of the health service industry. Now, Haley gave the little introduction there. Why Nashville? Why is Nashville the Silicon Valley of health services? Why in every coffee shop you go to here, there'll be 3 CEOs of a health service company trying to make healthcare more seamless. And it started, and some of you in the audience know it, it started 50 years ago today, or 50 years ago this month, around a yellow Formica kitchen table that I still have in my office, because even though I'm old, I'm not that old. But my brother, when he was about the age of many people in the room, 29 years of age, had an idea. And that idea is that health care, as it's delivered today, that was 50 years ago, 1968, is a cottage industry that is very siloed in terms of a doctor, maybe a clinic, and a patient. And there weren't payers involved at that time. Medicare and Medicaid had just come out. The blues and the whole blue concept was still fairly new at the time. But my brother, again, where did these ideas come from? Where did the ideas that so many of you in the room today have, as we look to the future, with the sort of gentle hand of entrepreneurship shaping and investment of capital shaping to exploding these ideas into reality, where does it come from? Well, my brother was a college student at Vanderbilt, not 2 miles from here. Again, this is 60 years ago. And his roommate was the son of Kemmons Wilson, who started Holiday Inn. Holiday Inn now is kind of a dated chain to many of you, but at the time it was the first chain that put a reproducible, replicable model where you're driving down interstate or driving down the highway, you saw a Holiday Inn, you knew it'd be clean, you knew you'd get good service, you knew what the cost was going to be. That was a totally new concept. And then about 10 years later, my brother ran into Jack Massey, who most of you don't know, but who started Kentucky Fried Chicken. And he paid, I think, like $1.5 million for it from Colonel Sanders at the time and grew it from 12 stores to whatever it is, thousands of stores today. Jack Massey was a pharmacist about 3 blocks from here. And Jack Massey, because he had this franchise model, to my brother, who was 29 years old, said, your idea of making a hospital sort of unite with another hospital and another hospital makes sense. Instead of a little cottage industry hospital being able to buy bed sheets for $5 a piece, if you're buying it for 3 hospitals or 5 hospitals, you can pay 25 cents a sheet. And for syringes and needles, if you can go to scale with it, this whole concept, which seems so sort of quaint at this point in time, innovated around that Formica table and the kitchen table, where Dad and Mr. Massey, Dad was a physician at the time, to this 29-year-old who said, let's go do it. And now HCA has spawned off 800 different companies today in this sort of big family tree that you see, 400 or 500 of which are in Nashville now, and is the largest operator of hospitals in the country, but second probably in the world today. But this idea of serendipity coming together to address a very human problem of access, of being able to build hospitals in communities, community-based hospitals at scale with a business model that allows you to reach out and meet many of the same principles that we've given a discipline today. I'm sure some of the speakers will talk about Clayton Christensen and his disruptive innovation, and that's where blockchain is. Meeting those 3 criteria of Christensen, of having a technology, and it doesn't have to be a device, but a technology or something that is new, and it could be access to data That's number one. And then number two, being able to reach it with populations that heretofore haven't been reached, or that other companies, traditional companies like payers, for example, or insurance companies, have kind of left as they've moved upstream. But to capture a population, and in a little bit when we're talking with Robert Wood Johnson, we'll talk about equity and vulnerable populations, because blockchain has the opportunity there before us to reach vulnerable populations in ways that never has been reached before. And then that third component of being able to benefit these Christiansen model, of being able to benefit not in healthcare, not just an individual or not just a patient, but a payer and a provider and a doctor with multiple benefits. And that's where the HCA model came from. The third thing I'll just mention to you is why government matters. And government matters in lots of different ways. But government in part explains why we don't see an Uber coming through in healthcare or a Netflix coming through in healthcare, because those really can go directly to people and work outside of a regulated framework. We see it with the Lime bikes and the scooters and the bird scooters, where you're moving faster than government, but eventually government comes back to regulate industries today, especially when it comes to the potential for health or health care. But when my brother started HCA, there were no healthcare companies in the Fortune 100. There were none. The barriers to entry were lower. Today we work in a highly regulated environment, and in part it's because government is there to improve access, but also to protect the patient, to protect the consumer. So we need to pay attention to that regulated environment as we go through, as we innovate, and as we execute, and as we implement those dreams and hopes that we all have. So we need to pay attention to government. Right now, healthcare is ripe for disruption, like no other industry. And the reason is because we have very, very, very high cost, which the typical consumer just simply can't afford. And we have that uneven access today, which means some people are getting really good care, but then there's a group of people, typically the more vulnerable people, who do not get that basic care and the sort of health care that they deserve. So when you have high cost, and when you have uneven access, the environment, the macro environment for disruption and for innovative disruption is huge, and that's where blockchain fits. With that, let me shift gears and bring a very close friend out to continue this conversation of health and healthcare and equity and the role that foundations and individuals can play. Dr. Michael Painter was a Robert Wood Johnson Health Policy Fellow for me when I was Majority Leader of the United States Senate. And that was 14 years ago. That was a long time ago. He left that position, and since that time has been at the Robert Wood Johnson Foundation. And he is an attorney, and he is a physician, and he is a health policy advocate. Join me in welcoming Dr. Michael Painter. Michael, come on out.
Yes, Senator. Hi.
Good to see you.
Thanks. Yeah.
Let's have a seat. And Michael, let's jump right in. We don't have much time here. We've worked together in the past, and it's been interesting as a healthcare policy person in Washington. You represented the Robert Wood Johnson as a fellow coming through. The Robert Wood Johnson Foundation, as an aside, I'm on the board of the Robert Wood Johnson Foundation, so Michael and I work closely together now. But most people don't know what the Robert Wood Johnson Foundation is or does. So let's start with the basics. But let me just preface that by saying the Robert Wood Johnson Foundation is the largest foundation in the United States of America that focuses on health and health care in the United States. The largest, by far, actually. The Gates Foundation, obviously a bigger foundation, most of its work is overseas in healthcare. So what about it? RWJ.
Yeah, no, thanks, Senator. And first, I need to say I did get to work as a fellow in Senator Frist's office of Majority Leader, and it was an honor of a lifetime. Just incredible staff, the sort of the intellectual rigor, and just the wonderful people. So thank you for that opportunity. We don't often get to sit up on a stage like this, so I wanted to take that opportunity and say that. So Robert Wood Johnson Foundation, that's been another amazing opportunity for me. And as Senator Frist notes, We are the largest philanthropy, really actually in the world, focused on the health of the over 330 million people living in the United States. And I chose each of those words pretty carefully. We could talk a little bit about that. But one, health. The discussion today has been healthcare focused, and we care deeply about healthcare, the health and healthcare of everyone living in the United States. But healthcare is just a piece of health, as we know. And so Robert Wood Johnson Foundation has a vision for where health in America should go, and we call that vision a culture of health. So what is that? Sounds great, and then you sort of immediately step back and go, well, what culture of health, what would that be? So it would be a time and a place. Actually, there are places in the United States that are living a culture of health arguably already, but this would be a time and a place where everyone, all over the United States, everyone living here would have hope, and then the reality, the opportunity to live a healthy life. And so you sort of step back and think about, well, what would that take? It would take great doctors and hospitals and access to health care and all that we know, but it would also take all the other things that drive health, and some of those things are arguably, possibly even more important than health care. When you're sick, you need great care. When you're not sick, you're sort of storing up all the resources and all the good to become healthy. So that's things like where you live, where you work, where you play, outside, the environment, things like that. So we spend a lot of time thinking about all those things and thinking how we can, and we obviously, Robert Wood Johnson, we have $11 billion. That sounds like a lot of money, but it really is a drop in the hat in trying to drive that kind of vision, as you know. We're working to inspire, help, nudge, learn about things to help leaders across the United States and this community and every community across the United States build toward that vision.
You know, so many foundations, you don't know how they really work. You hear about them. And the RWJ is interesting in that it's a big foundation, but the funding ultimately goes down to local communities. And the reason that's important, I think, especially for this audience, is that blockchain has this huge opportunity in terms of looking at distribution in a way that we can't by having just normal ledgers and centralized accounting. 20% we brag on Nashville and the companies, and you heard me open with the innovation. In truth, health of us and our family and the intimacy of it is not determined by the HCAs of the world. It's important, very important, as we know when we get sick. But the other 80% of health is non-facility, not even non-insurance, not Clinton care or Romney care or Obamacare. And it's in this 80% arena that RWJ works. When we say that the zip code correlates so much with our health, what do we mean by that?
Well, that's that point I was trying to make, that some people, and even within cities, have lots of opportunity, lots of choice, lots of assets, lots of resources to live a healthy life, including great health care. And then some people right across town might not. So that's what the zip code thing means. Just to back up a little bit in this culture of health idea, we spent a lot of time sort of mapping that out a number of years ago. So, and again, we are not solely driving this. We're sort of looking to see how we could help the United States move in that direction. And so if the United States was moving in that direction, what would you see? You would start to see things like, in every community, health became a shared value. You'd start to see lots more collaboration across healthcare and health and different aspects of society, different what we call determinants of health, housing sector, energy, transportation, that kind of thing. You would see a lot of communities like Nashville, and maybe we'll talk about that in a minute, coming together to build a healthier, like, okay, it's Nashville, let's build a healthier, more equitable place here in Nashville and every other city in the United States and town. And then that healthcare sector and the health sector, the public health and things like that, would start saying, oh, we're all in this together too. Let's start to integrate and data-wise, all kinds of things. And you can imagine, again, this sort of, like, well, where would blockchain kind of fit into that sort of integration piece?
I think that this integration, and as we, over the next 2 days, we talk about blockchain, this opportunity for integration, and still the same thing that my brother saw is a very siloed approach to healthcare, what that opportunity is to address the issues of a more assimilated, sort of an integrated approach in terms of analysis, figuring out what's wrong. And just kind of jumping to that, one of the biggest issues, at least that I see today, most people in this room get pretty good health care, but it really is the vulnerable populations. And the equity issues, how do you see that playing out? If we could improve sort of the equity issues and for the most vulnerable populations, on average, overall health care comes up. And what role does RWJ play in the equity issues?
Well, I want to flash back, if you will, a little bit to 2003, 2004, when you were a pioneer in sort of thinking about what we call disparities, health and healthcare disparities, and you wrote a bill and introduced it, and it was really a leader in the Senate and Congress, actually, about thinking about health and healthcare disparities, and that's really important. But that's actually even a different way of thinking about what we're talking about today. So healthcare disparities are sort of gaps. We say, well, that group is not doing so well. What can we rush in and help sort of fill that gap? Or this one over here isn't doing so well. What would we do to fill in that gap? But you're always kind of behind the game when you talk about it that way. This equity frame is really radically sort of different in a way. It's sort of saying, okay, that's great, yes, there are disparities, but we're talking about something different. We're talking about a better time and place for everyone. And that means not just filling in gaps. That means thinking bigger, thinking about how can this great country create that better time and place for everyone. That's how we think about equity.
You know, it's like having a horizontal sort of integration versus vertical integration. You really want to capture both of those axes coming in. And you're exactly right. Our thinking, and the reason we even throw this out, is that we need to think, we used to think so linearly, and now this opportunity that blockchain in its larger construct gives us is to think much more exponentially in a way that we can reach everybody, not just how poor they are, or not even just to where they live, but almost in an equal fashion, and be able to lift everybody up. One way that we're doing that I would again encourage all the participants over the next few days to look at it. In Nashville about 3 years ago, and it came from an RWJ meeting in New Jersey. I walked in one day and they had a big screen up, and you can go on the RWJ website and see what your county, how you rank within your state. And it's on about how many measures? 46 or 50 different measures?
Yeah, it's coming up on 50. Yeah.
On 50 different measures of what's called population health. Yeah. I hate using the word because what does it really mean? But on average, as you walk through the community and around Nashville, on average, what is the average person in Metro Nashville, Davidson County? And we weren't fifth in the state, even though I just said we're a hot city, you know, great restaurants, things going on, lots of energy, young people flying here, unemployment low, but we weren't first in the state, we weren't fifth or 10th or 15th, but we were 18th in the state in terms of those overall measures. So we started a population health initiative, and that sort of initiative really calls upon what a blockchain can provide.
Is that Nashville Health?
It's called Nashville Health, and it really goes at it that we have more doctors per capita here than these other counties. We got more medical schools, we got more Vanderbilts and Meharys and Fisk than any other county. But at the end of the day, our health does not come up to the level in a comparative way. And it comes back to this culture of health, where smoking is still very high. And even though we make great progress nationally on smoking since 1965, we've cut smoking half and deaths from smoking in half since that time. But still, there are these pockets there that we can only address not by a doctor in a white coat saying, don't smoke, but has to be that culture of health moving forward.
So Nashville Health, I'm a little bit ignorant, so I'm going to drive in. What's the approach there with data? I mean, how are they collecting data? How might we use it? Because that could be really helpful, I think, to people who are looking for a blockchain opportunity.
You know, this is, when I mentioned the sort of Christensen principles of disruptive innovation, he doesn't talk as much about it as I do in terms of identifying the problem, but is this data, how we gather data, how we use data, and in very simplistic ways. Again, it comes back to huge potential for blockchain. But it really comes back to really some basics. When we came back and we started Nashville Health, from a governance standpoint, we took the largest healthcare companies, we took the largest employers, we took the 120 nonprofits, and we put them in a room and we developed this community approach to this population health, Nashville Health. We took things like smoking, number one killer still in Middle Tennessee, hypertension probably equal, but a number two, it's sort of the silent killer because you don't know if you have hypertension, many people. And then we took child health and we took the built environment. So we took the problem was we didn't have the data. We didn't have the baseline to data to know if interventions were really making a difference. And so right now, we have a community health and well-being survey that you'll see advertised probably over the course of walking around Nashville that will look at 12,000 people online using very current, the most current, according to the experts around the world, data accessing survey type methods. And it is done online. And with that, we'll have 12,000 people, which will allow us both the baseline. And so that's good, and that's where we start, and that's where we're underway here. And then as the interventions come in, being able to reach the various populations that we know need access to certain data in a consumer-friendly, engaging way. So fundamental to all the 120 nonprofits who feel good, and the hospital companies, and the providers, and the doctors, and the academic places, without access to current data, real data that can be trusted, that is privacy protected, that is distributed throughout, not into the little tiny pockets down to the neighborhood, we cannot make any real significant progress. And again, it comes back to us thinking imaginatively about blockchain.
I mean, I know it's not incredibly interesting to hear the inner workings of Robert Wood Johnson Foundation, but I did want to just, well, how do we think about these kind of technological opportunities? And just a little bit more about, so we're not building the culture of health, but we have a role to play in sort of measuring, we talked about that, but also sort of where are we in making our investments? And so we have big groups focused on healthy communities, and there are all kinds of investments there. We've had a long-standing foundation focus on children and obesity, and we have a continued investment in that. We're really concerned about leadership, training the next era of leaders in this culture of health vision, and we're really, really focused on equity, of course. We also, though, are constantly looking at the fringes outside, both in the United States, technological edges, and outside the United States, around the world, looking for the best ideas that we can bring back here to help people like you guys build a culture of health. And so that's where our curiosity about blockchain lands. And I wouldn't say we have a huge book of business in blockchain, but we have dipped our toe in some. We invited the Hashed Health team to come to the foundation in Princeton back last spring, and they met for a full day meeting with interested staff. There were about 10 or 15 of us that stayed with them all day, sort of learning about blockchain and then running through some hypothetical use case scenarios. I also have one project with out of MIT Media Lab, Andy Lipman's lab on MedRec. You guys have probably heard of that. It's an electronic health record focus use case for blockchain. But we're open. Like I said, we have this gigantic vision that we want everyone in the United States to sort of work toward, and we're looking for the best ideas to get there. So that's where we are at blockchain, and I'm here all ears in the next 2 days to sort of learn about those kinds of opportunities.
Yeah, I think there's this huge distrust from politicians. I'm not a politician anymore, so you can trust me. But there's this huge distrust of institutions today, and again, we'll see it play out, I think, in the elections tomorrow. And it's not just in the United States, but it's globally. And you have a distrust in government, and again, I want to make the case. If you look back to PEPFAR, which is a bill that we did when I was in the United States Senate. It was just an idea. HIV/AIDS at the time was the number 4 killer in the world, but in Africa, the number 1 killer, but nobody was paying attention to it. In a bipartisan way, in 2003, the President of the United States led on the initiative. The bill itself was just a few paragraphs that we wrote, but it was bipartisan pushing it forward. And today, there are 20 million people alive from that one piece of government-sponsored legislation supported by the American people. So that's the top line. The bottom line is that the pharmaceuticals, which would cost $10,000, ended up costing $100, improved the access so that people could live. The device world was revolutionized in terms of the overall testing of who had HIV and who did not. When I first went to Africa, a simple test cost about $700, and then it fell down to about $5. The technology, the disruptive innovation that took place. You can look at the Human Genome Project, and Haley mentioned that right here we have the largest repository of DNA data right now in the country, in large part because government said of the universities it's going to be at Vanderbilt. But the Human Genome Project, again, all this distrust of government, it's been earned in part. But while in the United States Senate, we said it was going to take 15 years, and we finished it 5 years early. We thought it was going to take about $6 billion, and ended up taking only $4 billion. So finished quicker than we thought and under budget. And now we have the 3 billion bits of information which define your genetic code in every cell. We have that phone book now. And from that, thousands and thousands of genetic tests, genetic treatments. We probably have about 120 diseases which can be treated effectively genetically today. All of that has exploded because of this government work. And then I'll just say the distrust in institutions also applies to big foundations that are in New Jersey and New York. And what I appreciate by both your comments today and what the Robert Wood Johnson represents is that you are on the forefront. You are convening rooms like this to look at the sort of issues, to address this uneven access and these high costs in healthcare that come down to the benefit of individual families, individuals, your children, the next generation. So really appreciate your leadership in RWJ.
So hey, before we go, so you just gave us another window into this incredible experience you have. You're an unbelievable clinician. You have this amazing career as a majority leader and all the work you're doing now. And you sort of have this vantage point on the health and healthcare landscape. So what worries you? What are you excited about? What are your predictions?
Yeah, and we'll close with this because y'all need a brief break before we go. I am hugely optimistic about America. You look at what I've seen that you don't see if you just read the news every day. Childhood mortality in the world, where kids under the age of 5, obviously that's what we want to most invest in. But since 1990, that mortality, which was huge, has been cut in half in America. In smoking, I mentioned in 1965, we've been able to cut deaths from smoking, but also absolute smoking in half. Huge progress that has been made. I mentioned HIV/AIDS. Since 2005, we have been able to cut that overall mortality from HIV/AIDS, again, by 43%. From death from that disease. So we've made huge progress in going ahead. And I think the biggest challenge we have, and this will be my sort of final sentence, is for us to take the innovation that's in this room and the creativity and the dynamism that is there and exchange it with one another and stimulate those ideas and stimulate those dreams and then ultimately implement and execute that in a way that we can address the inequities, the disparities in our healthcare today. We're spending more than enough money in healthcare today. The problem is that 20 to 30% that is just wasted. And I really do, and I think hopefully you've got a little bit of a taste through our comments, believe that blockchain has the opportunity, and it's not there yet, that's why we're in this room, but it's not there yet, but to address one of those sort of basic sort of needs of humanity, and that is to make sure our children have a life of better health and better well-being than we have. Dr. Michael Painter, thank you very much for being. Y'all have a great day. Thank you. Appreciate it.
Thank you very much, Dr. Painter.